again, what's different about a trauma-based approach, oftentimes the symptom is the solution. You listen to what has gone on in the person's life and follow the symptom. Those symptoms become the door in the next piece of work you want to do. And so when they come into your office, often the first thing I'll do is I'll say, okay, let's go inside. And so instead of working on their outside world and their interactions with others, I'm going to work on their inside world. And I'll say something that will say, could you close your eyes and begin to allow yourself to re-experience some of that pain, some of those intense feelings. And then I'll use that pain that they've had last night as an affect bridge and follow it and see where it leads me in terms of the past. And as we begin to then process that piece of work, the need to have the symptom seems to disappear, because the symptom up to now has been like a red herring. It distracts them. It pulls their attention away. It keeps them from thinking and feeling. So by going back and beginning to resolve some of this, they no longer need to carry on the symptom. And that's really the goal. And so the key in doing this work is learning how to access the eating disorder itself, which is so often inside the bubble. It's inside this injured, fragmented, split-off part of self. And so many of the newer types of therapies, whether it be hypnosis, whether it be two-chair work, whether it be body therapies, whether it be EMDR, whether it be internal family systems therapy, whether it be Gestalt work, or whatever frame you have, the thing that all those therapies have in common now is that they seem to be able to help the clinician access this injured part of self. The habit strength is they've done something that's worked for a long period of time. They've developed a strong habit, and they've learned how to calm themselves and soothe themselves, and it's very, very effective. Most of them are getting very high. The high that they get from this behavior feels very narcotic-like, and they hate giving it up because it feels so good. Part of what happens in an inpatient program is that you're beginning to show them that not only can they eat, not only can they have appetite, not only can they give up that over-control, but when they do, that it doesn't turn out to be all or nothing. That indeed, they become human beings again, rather than some sort of machine. And as a human being, that they can listen to their bodies. And when they're tired, they can sleep. When they're hungry, they can eat.